and if you were designing a mind or a brain, it might not be a bad way to do it. But it's actually not how our minds and brains work. I mean, just think for a second. If you want to snag, say, health reform, how would you do it? Death panels, socialized medicine, a bureaucrat between you and your doctor. That's how you do it. Were those rational arguments? Absolutely not. It doesn't help when the other side, in this case, for some of us, our side, didn't answer any of those things. You know, I mean, when the death panels came out, there was a pretty obvious answer to death panels, which is we already have them. They're called insurance companies. That would have been the last time you ever heard death panels. But, you know, if one side is speaking to values, whether, you know, truth is another issue that some of us really value. And I would never recommend speaking untruths. But you can speak the truth evocatively or you can speak it unevocatively. And we tend to speak it unevocatively. People are not, in fact, listening to our 12-point plans. That's not what moves them. When you're finishing a message, when you've got someone who's with you and saying, you know what, I'm with you on your values. I'm with you on your saying, this is a real problem. Take me somewhere. All they need is a sentence. All they need is a direction that you intend to head. And they'll go, all right, this person's an expert. They seem to have their heart in the right place. They seem to share my values. They seem to understand and care about people like me. I'm following. The thing to understand about that is you want to know the best predictors of success of a campaign. This is in the case of a political campaign. One is people ask two questions of candidates, and it's the same is really true of an issue campaign. One of them is, and this is true of you as a messenger, when you're on television, when you're on radio, anytime you're talking to a group of people, one of them is, does this person understand and care about people like me? And the other is, does this person share my values? If you fail one or the other of those two tests, you're gone. You're going to lose the campaign, or you're going to lose as a messenger. You've got to win them on both of those things. Does this person care about people like me? Do they understand and care about people like me, and do they share my values? Finally, the third principle that I'll emphasize, and then I'll show you some examples. Know what networks you're activating. Let me give you an example of what I'm talking about. This comes from my background as a neuroscientist as well as a practicing psychotherapist for about 30 years. If I say to you the word kids or children, and I just asked you to say, and please just raise your hand real fast. We're only going to do this for 30 seconds. Just what's the first thing that pops into your head? Cute. What else? Children's. I'm sorry? Play. Innocent. Funny. I'm sorry? Vote. Future. Little. Happy. Okay. Well, you're actually killing my little experiment. Because you're actually responding in a way that is very much unlike what I expected, the way I expected you to respond. And that is that we're having a discussion, and it may be because we're speaking on a different level than the kind of policy level that was probably the elevated level, more like the elevated level you were speaking on earlier. But and maybe it means that we're actually speaking in a way that is the way we should be speaking with our fellow citizens, and that is that I was expecting to hear people say things like children's health or children's programs or things like that, because that's what we're talking about. And I was going to say, if we were having this discussion earlier in the day, and probably if there were more people who were say in their 30s and 40s, we'd hear things like, if we were having this discussion 8 in the morning, that discussion would be things like children's camp, or who's going to take them, or lunchbox, or what the point that I'm getting at is that is that the way that we think is that we have what neuroscientists call networks of associations that are interconnected sets of thoughts and feelings and images and ideas and values and emotions, and that they get activated in different circumstances. So if we were busy having a policy discussion about children's health, and I were giving a bunch of facts and figures, and I then said, children, you're likely to start rattling off things related to children in that way. If I say, think about your niece, now tell me about what comes to mind when you say children, then you're going to have a completely different set of associations to it. The reason I mention this and the reason I emphasize it is because every time you use a word and the order in which you use that word, that phrase, that sentence, is evoking all kinds of these associations in the back of people's minds. And we often are very careless about the way we activate associations, even though those associations actually shape so much of what people feel about the issue that we care about. Let me give a couple of examples. Universal health care. Can you think of a more dead, neutral way to talk about something that's incredibly important? I mean, think about it for a second. Again, I know many of you are advocates, so you think universal health care and you're thinking yes, and you've got lots of emotion circuits firing. For the average person, they hear universal health care and it sounds like the DMV, it sounds medical, it sounds surgical. Do you picture doctors and nurses with their hands on a patient, or a time when someone set a broken bone for you or anything like that? That's not what I picture when I hear universal health care. In fact, it has some associations that with white swing voters are a problem, which is that what a lot of white swing voters hear when they hear universal health care is they picture poor black and brown people in a big line at a public health clinic. And that's what they picture. And they think, ooh, I don't want to be part of that. They don't get good health care. And you know what? They're right. They don't get good health care. Now, if you say to them, do black and brown people get as good health care in America as white people? They'll say, oh, yes, of course they do. And they say, oh, good, there's a public hospital I'd like you to send you and your children to. They go, I'm not going to a public hospital. Right? That's the point is that you're activating all kinds of things with universal health care. I actually tested this back in 2007 when we said, I'm going to make a statement about some changes in our healthcare system that some people are talking about. I was at this time I was leading the messaging efforts for Families USA and the AARP and a number of other organizations like Herndon Alliance that were working on healthcare reform back in 2007, 2008, and we said there are three principles that I'm going to follow, but we preceded it by either I believe in universal health care, or I believe in a family doctor for every family. Now, we then said exactly the same three principles afterwards. We were really lucky to get to 50% saying, I'm for this policy if we began with I believe in universal health care. We routinely got 70-30 if we began it with I believe in a family doctor for every family. And you think about the difference. One of them is very evocative, and the other one isn't. The other one, family doctor for every family, also, by the way, completely inoculates against what followed. And that was part of the reason why it would have made much more sense to use language like that rather than bending the cost curve, which I don't know about you, but never really warmed my cockles. I mean, I don't know where my cockles are, but they didn't get warm. When race is in the room, understanding associations is especially important. And when you're talking about an issue like Medicaid or children's health, anything having to do with people who are poor or disadvantaged, you need to know about what's getting activated in the back of people's minds and how to counter it. So some examples of how networks matter and how we should instead be using the language of the kitchen table. Here are some words that and phrases I'd love for you just to all extinguish from your vocabularies from this day forward. Don't feel bad if you've used them 1,000 times, because we all have, but they're actually really bad for us. The unemployed. Why don't you want to do that? You don't want to do that because it takes real people with real pain and it turns them into a nameless, faceless mass. Try instead people who've lost their jobs through no fault of their own. The through no fault of their own is actually important because we have a natural tendency as we know this at least in the West, but I suspect that this is more broadly human tendency, but it's certainly true from studies from people in multiple Western cultures. That social psychologists